There's a lot of people that have Candida and fungus overgrowth inside their body because they have heavy metals in their mouth. They have mercury in their mouth. So they've been sick and feeling crappy forever, and they can't figure out why. They've gone to every doctor, every natural doctor, every medical doctor, everyone, and they can't get any solutions, any answers. The problem is in their mouth. Anybody relate to that at all?
Yeah. Fillings?
Your fillings, yeah, especially the mercury amalgam fillings. But it really can be any metal in your mouth. Good example, like Linda next door was telling me that she showed me an article. They actually printed it in the paper. This gal had a parasite infection throughout her whole body. And again, we live symbiotically. Everybody has parasites. We live with them. Okay, it's nothing to be scared of. She had parasites throughout her whole body. They were taking over her body. She actually had like hamburger face. It was like eating through her skin. She had bumps all over her whole body. Disgusting. And nobody could help her. Nobody could figure it out. She went and had a biomeridian test done, which I just bought a machine I'm totally excited about. But the biomeridian machine immediately pointed to her mouth. So the problem's in your mouth. Showed which teeth were the major problems. Those teeth that were the problems had metal in the mouth. She went to her dentist. She had all the metal taken out of her mouth. Parasites were gone in a month. If you see her, the before and after picture, she went from almost looking dead with parasites eating through her face to looking completely healthy, perfect skin in a month. So again, whenever there's an infectious organism in our body, there's a reason it's there. Either through toxicity, okay, from a contaminant like heavy metals and things like that, or because somehow in our body a breeding ground for that illness has developed. And that breeding ground for illness can be just like the pool and the mosquitoes. Think of a sewage lagoon or a sewage pipe, okay? Think of the colon, the intestinal tract. You don't think that thing gets filled with sewage? You know, you talk to some of the main, like Bernard Jensen, V.E. Irons, some of these guys, they dedicated their life to studying the colon. You want to know another guy who dedicated his life to studying the colon, which probably surprised you, was Harvey Kellogg, the guy who founded Kellogg's, like Kellogg's Frosted Flakes.
He said he was a flake too.
He was a flake? Is that what you said? I don't know about that. But he treated over 40,000 people with intestinal disorders. Claimed there was only 4 people he couldn't help with nutrition and colonics out of 40,000 patients. Because the colon is a breeding ground for disease. The colon is your pool that's nice and healthy at first, and then it starts growing a little algae, and then different types of algae, and then all of a sudden it's a breeding ground for mosquitoes, or we can call them parasites or fungus, whatever you want to call it. The breeding ground has to be there. The environment has to be right. Okay? Any questions? 'Cause that's deep stuff, man. No? Did I lose everybody? Yeah.
Okay, but not everyone would be as susceptible to people in the mouth, right? Because you don't see them in people like holes in their faces. So do you think
Right.
some people are just more susceptible?
Exactly. It
Yeah.
totally depends on the health of that person. You know, if that person's already a little bit compromised and they get the metal in their mouth, that might be what sets them over the edge. Some people can have mercury fillings their whole life and maybe feel a little tired here and there, maybe get a headache here and there, but never know it's a problem. So it totally depends on the person, because everybody's so different and unique, you know, and we don't know what's going on with people. So that's why, and I'll just introduce it real quick. I just bought a biomeridian machine, and one of the reasons I'm really excited about it is because it can tell you through checking 60 points on your hands and feet exactly what's going on in your body. Where your weakest organ systems are, where your strongest organ systems are. You did it.
Mm-hmm.
What'd you think of it?
I was really amazed by it. Yeah.
Amazingly accurate.
And all the information it gave. Yeah.
So it tells you where your weakest areas are and what you need to focus on. And when you work on your weakest areas first, the rest of the body kind of just starts to correct itself. So it's a good way to fix your internal environment and have a practical tool to use to do that. But what's really cool about it, it's not just, it'll check what your weakest system is. You can dive in there and see what's causing it. You can find different types of infectious organisms that are in your body. If you have heavy metals, if you have food sensitivities, you can go on and on forever. There's 60,000 different things in there to check.
So does this mean we should eat raw food? I mean, and how do you do that? I mean, I just can't even figure out how to just
raw foods.
I would love to answer that in detail, but the foods class is next week.
Okay.
And I'd really recommend everybody coming to both classes. There's a foods class 1 and a foods class 2. They're not the same class. There's so much to talk about when it comes to food, because we're going to talk really in detail about dairy, about meat, about wheat products. I'm going to give you a whole list of high residue versus low residue foods and what that means. How those different foods can or cannot feed infectious organisms in our body. So I'd really recommend you guys come into both of those classes. But the short answer to your question, yes, the more raw living foods you can eat, the better. But like I said, we'll really get into more detail on that next week. So